Assalamualaikum and hi everyone. Today our group will present about galactosemia. I'm pretty sure some of you do not know what is galactosemia. So today our group will explain further about galactosemia. Okay, galactosemia. What is galactosemia? It is an inherited disease in which the transformation of galactose to glucose is blocked, allowing galactose to increase to toxic levels in the body. There are three types of galactosemia. Type 1 is classic galactosemia that caused by deficiency of the enzyme galactose 1-phosphate uridyl transferase. Type 2 is galactokinase deficiency that is marked by an accumulation of galactose and galactitol secondary to the decreased conversion of galactose to galactose 1-phosphate by galactokinase. Type 3 galactosemia is galactose epimerase deficiency. It is associated with a deficiency of the enzyme galactose epimerase. Okay, now we proceed to etiology of galactosemia. Galactosemia occurs when enzyme called galactose 1-phosphate uridyl transferase (GALT) is missing or not working properly. This enzyme's job is to change galactose to glucose. When GALT enzyme is missing, galactose cannot be changed to glucose, so it builds up in blood in large amount. The excess galactose will affect many parts of the body and over time may life-threatening. Two other enzyme deficiency also cause galactosemia are epimerase and galactokinase. With a deficiency of one of these enzymes, the initial newborn screen will show elevated galactose level with normal GALT enzyme activity. Children with galactosemia due to deficiency of these other enzymes not severely ill as infants with classical galactosemia. They may be mentally retarded or have cataract if not treated. Thank you. Okay, let's proceed to pathophysiology of galactosemia. Galactosemia is genetic inheritance disease. The body is unable to use carbohydrate, galactose and lactose. In healthy person, liver convert galactose to glucose. But for patient with galactosemia, there is missing or defective of enzyme activity. Its result increased amount of galactose in blood cause galactosemia and in urine cause galactosuria. Okay, now we talk about symptom of galactosemia. A newborn with galactosemia who is fed with milk product usually will have jaundice, vomiting, lethargy, irritability and convulsion. The main symptom of jaundice is the yellowish discoloration of the white eye and the skin. Okay, so what happened to newborn that continued feeding milk product? This infant will lead to the cirrhosis, cataract, kidney failure, and lastly, probably mental retardation can occur. Okay, now let's talk about diagnosis. Okay, firstly, is blood culture for bacterial infection. Second, enzyme activity in the red blood cell. Third, ketones in the urine. Next, prenatal diagnosis by directly measuring the enzyme galactose 1-phosphate uridyl transferase. And lastly, reducing substance in the infant urine and normal or low blood sugar while the infant is being fed with breast milk or a formula that is containing lactose. Okay, let's proceed to prognosis. Affected individuals who are diagnosed early and avoid all forms of dairy product lead a normal life, but having been a few cases of malform of intellectual dysfunction in some people. For example, most people who are diagnosed early with classic galactosemia and carefully follow a galactose-free diet can have a normal lifespan. However, they are still at risk for cataract, speech defect, poor growth, poor intellectual function, neurologic deficit, and ovarian failure in women. If the treatment of classic galactosemia is not prompt and consistent, life-threatening complication and irreversible mental retardation can still occur. Early detection in newborn period is the key to controlling symptoms. Liver and kidney problems do not develop and initial mental development is normal. However, with the adequate treatment, children with galactosemia may have a lower IQ compared to their siblings and often have speech problems. For girls, often have ovaries do not function and only a few are able to conceive naturally, but for boys who have galactosemia, have normal testicular function.
Alright, hi. For the treatment for this galactosemia, first, the mother should prevent breastfeeding in the early neonatal period. Second, the mother should provide with galactose-free diet for subsequent pregnancy. And the infant should be provided with milk substitute formula, soy formula, and milk-based formula. And for the fourth point, the diet, the infant should avoid all products that contain or produce galactose, such as milk, casein, lactose, dry milk solids, curds, and whey. Another important information, some galactose and lactose are added in food products. So, as a parents, we should always check the food level. And lastly, always consult with skilled dietitian to manage this disorder. Okay, I think that's all from us. I hope you guys enjoy our show. That's all from us. Thank you. Bye.
Bye!
Stop.